Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll.
Alright, welcome to another episode, and today we'll be talking about NCDs and COVID-19. So I guess the question today will be very easy, but the conversation really will be around what is NCDs, what is COVID-19, how was your experience during that time, either as a person living with NCDs and COVID-19, or as a caregiver, or as someone who took part of the process to manage and control NCDs and COVID during the COVID-19 era. So my question for you today, we'll do an introduction and then just a few questions to find out how it was for you, and then we'll sort of bring it to a close. But before we get into any of that, give me a brief introduction to yourself.
My name is Monica Kinyanjui. I'm the founder of Women for Dementia Africa. A need that came up because of being affected by dementia for over 20 years. First of all, it was my mother, who passed on 15 years ago, actually tomorrow. And after that, after some time, now it's been my dad, her husband, who is now living in. My mother had the kind of dementia that is Alzheimer's. Now my father is living with a different kind of dementia that is frontotemporal dementia that is caused by different challenges in the brain. And as a caregiver for him, he's 92, but you could easily say it's an old person's disease, but that is not the case. Dementia is a disease, and you can live at 100 without dementia and live well. And that's the reason why I came up to set up this organization as a way to advocate, raise awareness, and also to educate people on different in the dementia space. Yeah.
Okay. Interesting to hear that the primary drive to start your work in dementia is primarily because of personal experience.
Yes.
All right. So I guess then the next question would be in terms of dementia itself. So what was that like? Like, what is it like living with dementia right now? And if also being a caregiver, so what is the experience like living with dementia yourself, but also like being a caregiver for others who are already living with dementia?
I don't have dementia, so living with dementia myself, I would not have an experience. But unfortunately in this country, the diagnosis happens when the disease has progressed. So when you start, behavior changes began, you don't remember the current information, but you do remember the past information. Like the current, have you eaten breakfast, or where are you disoriented? So, and the reason why it presents itself as a mental disease, the reason it presents itself as a mental disease, but the people who care for us, care for those living with dementia, are those with the neurological experience, neurologists, and those kind of people. So, for me as a caregiver, it's been a journey. First of all, of disbelief, because these people were able people. They were running businesses, they were doing life, they were mothers and fathers. Then suddenly they start changing, their behavior starts changing. Then you said, I don't know you. So first of all, you're in denial. And then initially, like for example with my mother, 20 years ago, there was not much information, and the internet was not as advanced as it is now. And like my father, where the information is there. And over time, even in this country, there's organizations that have come up and been set to raise awareness on dementia. So it's been a difficult journey knowing you're not even getting the support from the doctors as you would like, and even the stigma surrounding the disease because it's a mental health, and then of course, and this being your loved ones, so it's a very, very challenging disease, and you will not wish for any family to go through what we go through.
I see. So from 2020 to the stretch of 2021 when COVID-19 just stepped in, how different was the experience? How hard was it to take care of them? How easy was it? Was there challenges in even explaining what's happening at the moment?
It was tough. First of all, for us, as you know, 2020, COVID happens. We didn't know what was going on. And then shortly after that, you are told those affected in NCDs like diabetes. And remember, somebody with dementia will have another disease, blood pressure, diabetes, or they will be having strokes or different kind of comorbidities. But now for us now you start hearing, that's the story you're hearing. Those are the ones who are most affected. So you go into quarantine. And then you have to stay indoor with these people. And then they don't understand what's going on, why they cannot go for their walks. Because we didn't have enough information. We didn't know how far he would go. And then for his regular checkups, when now we realized that the aging are the ones who are most affected, we avoided the hospital. We avoided the hospital. Some small procedures that he would normally get, we avoided to do them, and we do it with care. We avoided even to getting health providers to come home because they wouldn't even want to come. They were not even available. So it was a very confusing and challenging time for us. And when it came to even when wearing masks, remember his brain capacity is not there, and he has no ability, so he wouldn't know why he wearing mask. Of course, he would remove it. He would not understand why he's asked to do this. Sanitizing would help because that's what we could do it. We would assist him. We would assist him in sanitizing his hands. But what happened? We kept up everybody. Then the caregivers, who are also affected, me being included, but not as much as the current caregivers, the nurses. We told them, you're not going home. You're not going for your offs. Of course, now there was stress. They missed their families. They didn't know what was going on. We told them, now if you go, the job ends. And they needed the jobs.
Yeah.
So it was very tough for everybody. It was a very cranky time for everybody in that homestead. Yeah.
Would you say that it made it hard in terms of even access to like medication if it was needed and care? Because one of the things we saw, because also we implemented a project during COVID-19, and literally the hospitals closed down everything else except COVID-19 care.
Yes.
And so the drugs were not there, the services were not there. How was it like now? Like, where do you source for drugs? Where do you look for caregivers? What do you do when it was all closed off and people could not even go outside?
From my experience, it was not as difficult. But I'll speak as a CEO for Women for Dementia. They would actually go to the ones who are normally oversee in this part of Nairobi, and that is Embakasi area. They would normally go, they would be taken by their loved ones to, for example, the level 5 hospital, that's Mama Lucy, and they would not get drugs, or they will say we are focusing on COVID. And of course, now knowing that you are elderly and you have diabetes and you have blood pressure and you have maybe dementia, so you avoided to go there. So you had to buy medication from, which was now even more expensive, from the pharmacies in their neighborhood. Yeah.
All right. So the question of stigma, I think it's a big question for people living with dementia and even Alzheimer's. And I guess the question is, have you been able to handle the conversation around stigma? And even more so during COVID-19, because then people begin to think that people living with Alzheimer's or dementia, because people don't understand the disease, and people think that they're just misbehaving, or then they're not now getting understood. So how has the conversation around stigma been, when talking about Alzheimer and dementia?
I think information about, more information on what dementia is to these people, so as to be able not to stigmatize the family. Dementia is stigmatized even from the family level. So you're not able to be remember me, it was began with my mother, now and then my father. So ideally in an African context, hiyo nyumba imerogwa. That home is bewitched, or they need deliverance, or it's a spiritual warfare, all those statements. But now having the information, I'm glad I have the information that I have, that I can be able to tell, no, it's a disease like it's like diabetes, it's like cancer. This just presents itself in the mental health space, and therefore we need to embrace it as a disease, and giving them information on what it is, and remember, and educating them that this person is not mad. They have moments when they are continent. There are some lucid. There are moments when they're lucid and they're able to share. They're able to recognize the environment and give you a statement that will take you back and say, oh, that is not somebody who is sick, that's when somebody is fine. So helping people know what the disease is and what it entails and how to care for these people. Because another thing that challenges people who care for people with dementia is not understanding. So you have a caregiver who is agitated, and the patient is agitated, and because they're not agreeing. And we always say, because these people are living in their own space or their own world, coming to their reality. If they're saying that I want to go home and this is their home, don't argue with them and say this is their home. Use other methods that we empower you with, like distract them, like take them for a little walk, like maybe share them something nice, or just and the beauty about dementia, the quote unquote the area that you can survive through dementia is a short memory, that you'll talk about, I want to go home and this is his home, and the next minute you'll forget. So take advantage of that space that he is in, and not agitate the person, because when you agitate you get mad, they get mad, they even hit you. You get upset, you say, I'm no longer taking care of my dad or my mom or my husband or my wife, and you take off. But I can't have it. The idea is just to be able to understand. That way, even when the people see you're able to care for your loved one well, the stigma goes. Because you have not abandoned that person.
All right. I tend to think that there is usually, it's always a very interesting experience living with someone with dementia, just because sometimes there is the short memory lapse, and then sometimes they remember things.
Yes.
And then they are able to tell you things that even yourself did forget. So the question is, sort of, have you experienced those moments where you're like, this is interesting that you remember this and I can't, or this happened and that this memory came up at this time?
Yes, I've had several times. Many times with this, my dad, because I'm his daughter-in-law. He'll call me mama. He knows he'll call me mama. He knows I'm a very important person in his space. And then once in a while, he'll call me by the way he used to call me, Mama Njui. And then I even give him kind of like, I don't give him a hug, because customary I can't give him a hug. But actually tap his head. Oh, you remember me? You actually remembered me. Not calling me mama like anybody sees. Those are those moments. Even I remember now, like my mother who passed on 15 years ago, when I would go, and my other particular time I had a challenge with a teenager son, and I would go to a mother's, where you're missing your mother because you can't converse, and you go and tell her, oh, this is going on with my son, we've been set out of school, we don't even know what's going to go happen. And then he just says, she says, you have to be patient with your children. They will grow. Then I realized, who is this talking? Aya, you're back. You're talking like the mom I know. Those are memorable moments.
All right.
Yeah.
Interesting. So, final question, or maybe second to last. And the question is around particular advice or sets of principles that you could give to people who are taking care of people living with dementia, and how do they take care of them, but also what other specific lessons did you learn during COVID-19 when you're managing that, and it was a particularly hard time, that then in the event that we have a future event like COVID that gets people indoors again and quarantined and with masks on, that they are able to have these tips to be able to sort of educate them. So what tips and lessons and learnings can you share?
For future pandemic, for future pandemics.
Yes, or situations like that.
I think, again, is just being able to love your loved one. Just being able to also, as a caregiver, also self-care yourself. Because if you don't care for yourself, like doing things that you're able to do, like if you're quarantined, you can exercise within the environment, even a small space, so that when you go back to this person, you're able to serve this person. And then for now, I'll come now in the heart, I'll wear the heart of Women for Dementia, not as a caregiver, because one of the challenges we saw was people who had dementia getting hungry, and they can't understand why they're hungry, and they would wander away. They would wander away, and they would end up in a matatu station, and they're looking confused, or in a police, or they are taken to the police. So the government to be able to mitigate such areas, that these vulnerable people, when times like this, are you able to give them some basics, the basics like that is food, a proper shelter, etc. And when they do come to you, if it's your lawmaker, do not put them within, don't lock them up with criminals. And they were saying they actually went to the kiosk and picked a soda of somebody, because those are the incidents I was hearing, a soda of somebody, or picked a bread. Don't put them as criminals. To understand this person, even the way they look, they're not well, and help them in that area. So have strategies and structures that can take care of people living with dementia, especially in times like that, because they will still wander away. They will get a door that a gate is open, and they will go off. And remember, they're the most vulnerable to catch dementia, because they don't have the care of sanitizing, and they don't even have masks on.
All right. So last question. Moving forward, do you see that there is hope? Is there hope, and are we better prepared because of COVID-19 to handle similar scenario better when it occurs?
No, we are not.
We are not prepared.
We are not prepared.
We haven't learned.
We haven't learned. We haven't learned, and we haven't learned at all how to care. I think it just catches us unaware, and history repeats itself. Yeah.
So I guess if you aren't prepared, then the other question is, what are you doing as Women for Dementia to ensure that we get better prepared?
Information. If you give information and raise awareness of what dementia is, the stigma will not be there. To no longer be. They'll just say, "Oh, ni mgonjwa kama ugonjwa mwingine." So it will never be that way. So if people have informed, a population gets lost without information. So if they're more informed, and that's the little we are doing. There's Women for Dementia. Currently we are having support groups, so we are helping them in Kayole, helping them know what this disease is. That way they will pass the information to other people. And that area, like now, for example, in Bakassi, the stigma will have gone down. And I've seen people are able to come up and speak up. Yeah, without.
Okay, exciting. So despite the fact that we haven't learned you are doing something to ensure that we learn.
Yes, in my own capacity.
Yeah. All right. So I guess starting with that, thank you very much for agreeing to come on board this very cold Nairobi morning.
Yeah.
To have this conversation, and yeah, we are hoping that this will help get more people at least learn a thing or two about dementia, but also about the experiences with COVID-19 and what potential lessons we can have to prepare us for the future.
Yes.
All right. Thank you very much.
Thank you.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.